So the question of what is functional medicine, it's a difficult question. We can start out with the basics, which is it's really a patient-centered form of medicine. It's holistic and it addresses the entire person rather than breaking them down to an organ system or a particular disease, which is sometimes how we refer to patients in medicine. It's not the man with the liver disease, it's the liver in room 2. So that's not really what we're trying to do in functional medicine. But I think functional medicine in many ways is a reaction to the American medical system, which during its golden days had great traction in being able to make a diagnosis, apply a medication to it, and treat people in ways that they hadn't been treated before and actually cure disease. And we have a legacy of that that has continued through our medicine. But that model now, in many ways, lets a lot of patients down. They just really can't get what they need from that system, partly because we're dealing with much more chronic disease that is multifactorial. Many organs are involved, and it really requires looking at the whole person in a different way. And that's where functional medicine has come in. It's generally outside of insurance, and it allows for testing that many times insurance companies don't pay for, and it allows for evaluation and an opening of the mind towards diagnoses that oftentimes are not considered or that are just not, you're not able to arrive at with the testing that's available. In many ways, I feel a little bad for my physician brothers and sisters out there who are trying to practice within an insurance model where there is so much restriction around what you can order. It limits the diagnoses that you can make, and it limits the patients that you can actually help. So those very patients, the ones who are falling through the cracks in the system, have pushed this form of medicine forward in asking for more and asking for us to do more. So in functional medicine, we take a deeper dive into metabolism to look at the biochemistry of a particular illness, to look at the minor facets of it that really, when they add up to chronic disease. In many cases, there won't be one drug that treats them, but it will require a lifestyle modification, diet and exercise. And I think also in my Western training, I was trained like, you can't get them to change habits. You can't educate people to do this. But in functional medicine, and many times in functional medicine outside of the insurance model, we do have the time to take to retrain patients in how they eat, what they do, and to show them that their habits really lead to the biochemical changes that lead to chronic disease. These are all things that we can assemble and put together in a holistic way that addresses patient issues that in many cases are not being addressed by the current system.